Hi, my name is Pooja Patel. I'm a registered nurse and diabetes educator from Toronto, Canada. My purpose with Wellness Chronicles is to provide expert and evidence-based information that is easy to understand, to recognize, to manage, and to even maybe reverse those diabetes symptoms. So lifestyle change is very, very difficult in and of itself, let alone doing it alone. Wellness Chronicles, it serves as a medium that is encouraging, supportive, and is motivating to actually implement those lifestyle changes to lead a happy, healthy life. So thank you so much for joining me for the first episode of Wellness Chronicles. This episode, I thought we would talk about what diabetes is, how it's diagnosed, what the parameters are, and really what that means for you and how you can recognize and manage it. Every time I see a patient, the very first time, I always like to ask my patients, what do you think diabetes is? What is diabetes to you? And my patients almost always tell me that they just ate too much sugar, which is why they have diabetes. And I always tell them maybe 5 to 7% of your sugar consumption will lead to that diagnosis, but not altogether. There are many other risk factors, like how much physical activity you have in a day, how much alcohol you're consuming, your genetic factors, your socioeconomic status, etc., etc. So there are lots of factors to consider. But this week, I want to talk about what those numbers mean, how a physician will diagnose you with diabetes. So let's start with the types of diabetes that there are. So there's 4 main types of diabetes. So the first is type 1 diabetes, and there's type 2 diabetes. Then there's gestational diabetes, and then there's diabetes that is diagnosed as a result of an acute illness. Let's start with what insulin does and the role of insulin with diabetes. So insulin is a hormone in your body. It takes the sugar from the meal that you've eaten and pushes it into the cell so that the cell can function. The cell is able to contract a muscle, make a heartbeat, make you move, make your brain work. So with type 1 diabetes, the pathophysiology or the science behind it is that your body just doesn't make enough insulin or at all. And the reason for that is it's an autoimmune disease. So autoimmune means that your body is attacking its own pancreas, so it's not making enough insulin. So that's the long and short of it. The way to diagnose type 1 diabetes is you would have those diabetes symptoms. So for example, you would be very, very thirsty, you would be frequently urinating, you would be starving all the time, constant fatigue. But along with these symptoms, you will certainly have a blood marker. So if we draw a blood sample, there will be antibodies or a blood marker that will identify that your body is attacking itself, which is why it's called an autoimmune disease. Now with gestational diabetes, which is the second type of diabetes that I want to talk about. So gestational diabetes in a nutshell is when you have diabetes as a result of the pregnancy because your body is not able to keep up with those hormones. As soon as you have delivered your baby, the gestational diabetes does tend to go away, but you do have to be very, very careful as to how you manage your diabetes because you are at risk for developing type 2 diabetes in the future. Type 2 diabetes is what I really want to spend some time on. So with type 2 diabetes, there's 2 sort of pathophysiologies, insulin resistance and insulin sensitivity. So with insulin deficiency, your body is just not able to make enough insulin to keep up with the meal that you have just consumed. A little different than type 1 because your body is not attacking itself. It just means that your pancreas is not functioning at the level that it used to be. With insulin resistance, what insulin resistance is that your body is making too much insulin, but your body is not able to recognize that insulin to use it effectively. So it doesn't even recognize it to take the sugar and put it into the cell. And this typically tends to happen with those, especially who are overweight, who lead sedentary lifestyles. Okay, so let's talk numbers. So there are 3 numbers that you really should be looking out for. The first is your fasting blood sugar. The second is your 2-hour post-meal sugar. And the third is your A1C, which is your 3-month average as to what your sugar looked like over the past 3 months. So the first, which is your fasting sugar, should be less than 7 millimoles per liter, or that is 130 milligrams per deciliter. The second number is your 2-hour post-meal sugar, your postprandial sugar. It should be less than 11.1 millimoles per liter, or 200 milligrams per deciliter. And last but not least, your A1C, which is your 3-month average, should be between 6 to 6.4%. If two of these numbers are higher than these parameters, then your physician might consider diagnosing you with pre-diabetes or diabetes. So now what happens if two of these numbers are out of range? Your physician will diagnose you with either pre-diabetes or diabetes, probably recommend and give you 3 months to reverse these numbers or to bring these numbers down or within range. If within the 3 months, you are not able to reach those numbers or not able to bring those numbers down with healthy lifestyle modification behaviors, then they might consider giving you another 3 months and then a follow-up. Or they might say if your numbers are very, very high or have no improvement, they might put you on a low dose metformin. So what are these healthy lifestyle behaviors? A lot of times patients don't know. They will get the diagnosis of diabetes from their physician, but they won't know what to do within those 3 months. And so they're still at the starting point even after those 3 months because they don't know what to do or how to start or where to start. And that's where I come in, or as a diabetes educator. My role as a diabetes educator is to help you or to work with you to understand your lifestyle and how we can implement changes slowly to try and bring those numbers down. So how to plate a balanced plate, how much activity to incorporate within your lifestyle based on what your work is like, what your personal life is like. So based on all of these factors, I work with you and provide you the tools and the resources that are evidence-based to be able to bring those numbers down within the first 3 months. I was actually diagnosed with gestational diabetes with my first son. I thought I understood how to manage my diabetes. I thought I had all the information to manage those numbers, to bring those numbers within defined limits and to manage my diagnosis. So the endocrinologist had given me a week to record my numbers, to keep a food diary, and to bring it back within a week to make sure that I am on track. Now, after a week, when I did follow up with my endocrinologist, she was very unhappy with those numbers because there was no difference, there was no change. And then she suggested that I go on insulin to manage my blood sugars. Now, this made me a little nervous, and I was not happy to go on insulin because I thought I could do it if I had a roadmap as to how I can decrease those numbers. So I set up an appointment with a diabetes educator who gave me that roadmap, who was able to work with me to be able to tap into my food preferences, to be able to increase my level of activity based on my 7-month pregnant self, to be able to work with my job and my lifestyle to be able to manage those numbers. Going to that diabetes educator was the best resource at the time, or was the best course of action at the time for me, because now I'm able to use those practices, use those suggestions and behaviors for the rest of my life. So I really do subscribe to these healthy behavior modifications because there is so much evidence based on these healthy lifestyle modification behaviors and how it impacts overall health and diabetes. I'm going to give you 3 studies that were done based on healthy lifestyle modifications and its impact on diabetes and overall health. So the first study that I want to share with you is a Finnish study that was done over 4 years, concluded that implementing healthy lifestyle behaviors, a healthy active life, decreased the risk of diabetes by 58% and all-cause mortality. So the second study is a Japanese study which was conducted over 4 years, also reported that the participants who implemented healthy behaviors in their lifestyle had a risk reduction of 67.4% of diabetes. So they reduced their risk by 67.4% of diabetes. Third, and the very last study that I want to share with you in terms of statistics is a longitudinal study that was done over 28 years, which is a Chinese study. They reported that the participants who participated in healthy lifestyle behaviors had lowered cardiovascular risk significantly, lowered their risk for diabetes significantly, and lowered their all-cause mortality as compared to those who did not implement those healthy behaviors. I know all this information sounds very overwhelming, but I think in my personal experience with patients and my own, I think making one small change is the key to sustainable success and change. That brings me to the pro tip for the week, or for the episode. My pro tip for this week is, after you eat, after a meal, don't sit down on the couch and watch Netflix or scroll through Instagram. Move your body for 5 to 7 minutes. Be as active as possible for the first 5 to 7 minutes after your meal. What this will do is this will help decrease the insulin resistance and decrease your sugar spike after your meal. So that 2-hour post-meal sugar will be much more steady and it'll be much lower. So move your body, be active for at least 5 to 7 minutes after a meal. So go up and down the stairs, go for a walk around the block, do household chores. Just be as active as possible for the first 5 to 7 minutes after your meal. You will find that it will decrease your insulin resistance, it will decrease your 2-hour post-meal sugar, and it would also decrease your 3-month average, which is your A1C. So that brings us to the end of the episode. Thank you so much for listening to Wellness Chronicles' first episode all the way till the end. I really do appreciate it. If you did find any information helpful for yourself or family or friend, please do subscribe and share this episode with anybody who you feel might benefit from this information. It really helps me create more expert and evidence-based content to share with you in an easy manner, so that way we have a happier, healthier community. Until next time, please stay happy, healthy, and kind.